Hi, I'm Dr. Aaron Dodini, founder of AXON Digital Health and Diagnosis, or AXON ADHD for short. Do your patients come through the revolving door of your office complaining of chronic anxiety, depression, burnout, and poor follow-through? They might have ADHD. Recent studies put the prevalence rate of ADHD among adults at 1 in 10. So 10% of your practice has ADHD. Sadly, only 1 in 9 has actually been identified and properly diagnosed. Why? Well, patients and providers often indicate that the cost of ADHD assessment is too expensive, it takes forever, and sometimes the results just don't feel reliable. That's a problem for primary care because undiagnosed ADHD is often misdiagnosed as depression, anxiety, substance abuse, or other behavioral health issues. These patients require 20% longer visits, are often more difficult to diagnose and treat, and are reimbursed to your practice at significantly lower rates than other higher medical care needs. AXON ADHD helps primary care groups identify these patients in days with diagnostic certainty at a fraction of the cost of traditional ADHD assessment. First, we collaborate with practices to proactively screen patients before their annual visit through our specialized link in your EHR. Patients complete the free behavioral health screening, and results identifying risk for depression, anxiety, substance abuse, and ADHD appear directly in your EHR. Secondly, patients who screen positive are automatically referred for an FDA-cleared comprehensive neuropsychological evaluation. They complete the eval online, then meet virtually with one of our licensed psychologists and receive clear results within days. All parties receive a concise report with objective data, diagnoses, and treatment recommendations, so your providers can move forward with diagnostic confidence during the annual visit and move quickly into treatment. Lastly, follow-up visits can optimize titration of medicines in days instead of the typical months-long process. Proactively encouraging all your patients to complete our free behavioral health screening could change their life. It will certainly make your clinical workflow easier, helping you deliver better care and improve efficiency. You can increase revenue for your practice by billing CPT codes for the screenings and collaborative care models directly to insurance. And by partnering with AXON for behavioral health needs, your providers will have more time available for patients who have higher care level needs, improving revenues by about $100,000 per provider annually. By partnering with AXON, you'll have all of this with no additional cost to your practice, no additional time to your staff, higher revenues, just better behavioral health diagnostics for primary care. AXON Digital Health and Diagnosis. Call us today to team up.